Hello and welcome. Welcome back to blackdoctor.org, where wellness and culture connect. I am Dr. Cordai Decoto, board certified podiatrist, a fellow of the American College of Foot and Ankle Surgery, and the podiatrist for Neighborhood Health, a federally qualified health center in New Jersey, providing care for all, regardless of immigration or insurance status. I'm also the founder of Sisters in Podiatry, a Facebook focus group for Black women across the United States and the Caribbean, and your host of Stepping Forward with Dr. D. And I'm so happy to be back, and this show is going to be fabulous. I've created this platform so it's a comfortable, safe, and fun space to learn about all things of the lower extremity. So grab your favorite beverage, I have mine, and join us. And let us know where you're coming from: New York, New Jersey, LA, Chicago, Miami, wherever you're from, we want to know. And with no further ado, I'm going to start with my first guest. Okay. First guest is Dr. Ebony Vincent Sleet.
Hello.
Welcome. Dr. Ebony Vincent Sleet is a board certified, highly trained foot and ankle surgeon in Orange County, California. She has extensive experience in the latest treatments for foot and ankle conditions and specializes in minimally invasive surgical techniques, corrective and reconstructive foot and ankle surgery, and beyond. She did her undergraduate degree at the HU, Hampton University, and she did her podiatric studies at Des Moines University. She went on to complete her 3-year residency at Inspira Health Network in Vineland, New Jersey. She also trained under top orthopedic and podiatric physicians in advanced treatment for children and adults with limb length discrepancies, non-unions, bone defects, and beyond. She has published several research articles. She is currently the board member for the large California Podiatric Medical Association. And you've seen Dr. Vincent on what? My Feet Are Killing Me on TLC, which she had 5 fabulous seasons. Welcome, Dr. Vincent Sleet.
Thank you, Dr. D. Appreciate it.
Thank you. Thank you for joining us. And that's my friend, and she's a member of Sisters in Podiatry. My next guest is my friend. I guess we call him my podiatry husband, Dr. Jody McAleer. Welcome, Dr. McAleer.
Dr. D, how are you?
I'm good. So Dr. McAleer is a fellow of the American College of Foot and Ankle Surgeons, board certified by the American Board of Foot and Ankle Surgery. He completed his hospital residency training at Mount Sinai Hospital, Icahn School of Medicine in New York, New York. And he serves as a vice chief of staff for Jefferson City Medical Group, Outpatient Surgical Center, and is a member of the fabulous scientific advisory board to Treece Medical Concepts in Ponte Vedra, beautiful Florida. Welcome.
Thank you so very much.
And our last guest, who we love, is Ashley Pittner. Welcome, Ashley. Ashley Pittner is the area sales manager for New Jersey and for Treece Medical Concepts. And she has been a professional in the field for over 14 years, dedicated to sales and marketing roles, particularly within the orthopedic and foot and ankle sectors. Throughout her career, she's worked with several notable organizations such as Zimmer, Biomet, Additive Orthopedics, and more, and has been for the last 4 years the area sales manager for Treece Medical in New Jersey. She's earned numerous awards for her performance. Her success in the industry is a testament to her strategic approach and commitment to excellence. She believes in the power of mentorship and is dedicated to inspiring and guiding colleagues to reach their full potential. Welcome, Ashley.
Thanks, Dr. D.
So we're going to take a little things. I have a connection issue. So guys, give me 1 second. Okay. I apologize for that. I'm seeing a connection issue, so we're going to get that straight.
As your podiatry husband, I think you look great, Dr. D.
Thank you. Give me 1 second. I just wanted to make sure this goes through. And then we'll get started. I had a glitch. Something's glitching, and I want to make sure everybody can see what they need to see. So hopefully there's no issues, but I'm sure you guys will let me know. Okay, hold on. think I'm going to have to let that go and we're going to focus. Okay. Things happen. All righty. So one of the things that I love, I have been trained by Treese Medical, myself, Dr. Ebony Benson-Sleet, Dr. McAleer, Ashley Pittner. We were all in Ponte Vedra, Florida. Absolutely gorgeous. And I'm going to start with Ashley because people are like, what the heck are you talking about? 3D bunionectomy? Like, what? Is something new? And I've been like, yeah, there's something new. Where have you been? And one of the things that I think that Treese does well is that they market extremely well. That's something they just market well. So, I want to ask this question particularly, what makes Treese unique? We know, particularly as surgeons, there's many competitors whose names we will not mention. And, we have patients who come in and they're talking about lapoplasty. And I'm impressed when a patient can come in and say lapoplasty. Like, how do you know about lapoplasty? Because again, we're having these fabulous, social media marketing that you do. So tell us about Treese and why Treese.
So I would say for me, and what drew me to Treese Medical was I was going on the internet and looking at what's the next step in the industry, who's like pioneering. And the first thing like that kept popping up for me on like Google was Treese Medical and lapoplasty. And it was just like the first thing that would come up, and I would click on the link, and the website just had so much educational information. There was information on like how the procedure is just different from current procedures and ways to make you just more comfortable in choosing a surgeon, and then also choosing the procedure with that surgeon. So once I saw that, I was like, okay, I'm enticed. I kind of want to work for a company that's really investing in patient outreach programs. That was 2020. Now, 4 years later, we're really like on every platform. I think after COVID, social media just blew up everything, and every channel is just insane. And we were able to, I think, which is great, is just like hit every single platform that allows patients to go to the website and figure out and find the information they need to then choose the right surgeon in their area that's best for them.
Amazing. So with all that being said, I see Joy Palmer. Thank you, from Greensboro, North Carolina. You had bunion surgery that didn't go so well. Hopefully we can shed some light on that. But the first thing is, we hear about bunions. Dr. McAleer, I know you have a great demo. What is a bunion? Because Lord knows people mix up terminology, and we have people in our office calling things that are not correct. So can you give us in layman's terms and a visual, what does that look like?
Sure. Everyone just thinks bunions are a lump or a bump on the side of their foot that just grows out of the side of their foot. I mean, we hear this in our practices on a daily basis. And realistically speaking, it's kind of true and it's kind of not, right? So here's a model, right? So I have a model for everyone. All right, so I get disoriented and kind of erase these plates from your mind right now, because this is pre-surgery. But what happens with the bunion deformity is the first metatarsal is going to rotate.
What's the first metatarsal? That's a big word.
Metatarsal is one of the 5 long bones in the foot. And these are the bones that sit right behind the toes. So they make a joint, and this is the big toe joint. And the big toe joint is made up of the first metatarsal and a bone here called the proximal phalanx. So as this metatarsal shifts out of position, rotates, elevates, and shifts, the big toe goes the opposite direction, and then you get this protrusion on the side of your foot, and that's what we call a bunion. So you can see it's actually an abnormal position of the joint more it is than an actual growth on the side of the foot.
So Dr. Ebony Benson-Sleet, since we're on Oh My Aching Feet, that means people are walking in high heels. I know, especially as women, they're walking in their Manolos to their what have you. And when you tell a woman particularly that she can't wear heels, like clutch my pearls. And, what are we going to do about that? And so tell me why you in particularly have, because I know you do this procedure a lot. What do you advocate to your patients about doing lapoplasty?
Right. I feel like a woman might try to fight me if I tell her that she can't wear her high heel shoes anymore. So I try to not say that. But no, like Dr. McAleer was saying, I pretty much start off with a lot of patient education. And I think the patient education is what Treese Medical has really nailed down. That's why it's become so popular, because it makes sense. Like once you understand the anatomy, once you understand why it's not the best thing to just go reshape your metatarsal or the long bone that's deformed, and what we're doing is trying to correct for the biomechanics, people are like, okay, yeah, this makes sense, you know? So I definitely try to educate my patients on the fact that, hey, like you don't have this weird growth, you know, this is something that most likely is genetic, that has become worse over the years. Yes, high heel shoes are probably not the best for you, but they're probably not the best for everybody. Our feet are not shaped like a triangle, you know, but once I educate patients on the anatomy of the foot and kind of explain to them the theory of a 3D bunion rotation, they're usually very much so on board for a correction.
And 3D
Obviously,
meaning
I'm sorry.
enlighten us. What does that mean? Because people use 3D glasses. I just saw Transformers and it was amazing. But what does that mean when you see
Right.
3D? It was.
Right. What
I
does
mean,
that
hey,
mean?
You just
So-
saw that? I thought that's phenomenal.
listen, I love DC Comics. I love everything. I'm like, bring me. I'm going to watch all of it. Okay, so yes, I watch Transformers. No judgment.
Well, it's kind of like that though. Like 3D makes you feel like you're in it, like you're there. It's real life, right? So in real life is not 2-dimensional. So you have to hit the correction from all 3 planes in which the deformity lies. Like if you're gonna look at someone and say, let's pretend we're just in 2D, it's like you're watching a movie. You know, they're gonna be like, whoa. So yeah, like I mean, I don't really go into the whole biomechanical detail about, you know, transverse frontal plane, you know, all that stuff with the patient, but it does make sense when you're able to see it rotate. And like again, like Treese Medical with the videos and the online representation of the education, patients are literally able to see like bunion, no bunion, you know?
And talking about that, I'm going to ask our producer to put up some of the Treese medical pictures, because one thing they do, I think, is amazing, is that it's very visual, where you could be like, oh, that's what it is. The Leaning Tower of Pisa is my favorite one, because I think everybody gets that. Like, okay, I'm here. So if our producer can put up some pictures that Treese Medical has been so kind to send, then we can talk about that, Ashley. Let me see if she can get that up. Just give her a second. Da, 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 da. I'm going to check to make sure she can. If not, we'll go back and keep chatting until she can. One of the questions I wanted to ask anyways, which Ashley, one of the things I loved about, and we'll get into the bunion pictures and all that, guys, and your problems. Some of y'all are my patients. I've seen you, so. But one of the things that I loved about Treese Medical was that we had the opportunity to be at Ponte Vedra for training. And one thing I think it's amazing when you can do hands-on, in addition to the fact that Treese, well, I guess we're going to be going to Dr. McAleer because that's better. But because that was not what I wanted, but that's okay. So Dr. McAleer, we'll switch back to Ashley in a minute. Yeah. So that's a great picture. That shows before and after.
That
and
is before and after.
The incisions look a little gangster. Talk to us about it.
Yeah, so this is not just a patient that has a bunion, actually. So Dr. D, this is a patient that has a condition called metatarsus adductus. And so metatarsus adductus is a deformity of the foot that you're actually born with. And a part of that deformity is you also have a bunion, which is progressive. So not only is the first metatarsal out of position, but the second and third, and sometimes the fourth and the fifth metatarsal bones are also shifted towards the midline of the body. So in order to get that first metatarsal position back into place, we have to work on the adjacent bones as well in order to get a full correction.
Okay, that makes sense to me. I like it. If our producer can take that picture off. And then what I would like to go, if I can, since we're on Dr. McAleer, we're going to keep going on Dr. McAleer for now. And then Dr. Vincent, I'm bringing you in. If our producer can show some x-rays, because I think the x-rays are amazing to show, you know, what we're dealing with inside the foot. because people see the outside and will say, "Oh, that bunion is bad and unsightly." But what we're dealing with inside the foot is, the things that we like to show you guys in X-ray. That's why we take X-rays to see how are we bringing something leaning this way to being straight. So if our producer can put up the X-rays.
Yeah, Dr. D, we
Yes.
see for patients that are coming in with bunion deformities, about 30% of the patient population is also going to have metatarsus adductus. So it's an interesting conversation to have with your patient when they come in, and you have to tell them, yes, you have a bunion. Yes, we can do Lapiplasty, but we also have to do this other component of the surgery called an adductoplasty, which corrects for the other bones. And again, it's done in a very reproducible and metered fashion with specific instrumentation to get the job done. So it's going to be a very similar experience for every patient.
And one of the things that I like, and I'll split back and forth as we're getting the X-ray pictures up, is that training. So this is new. This is the new hot stuff. And if you go on Teresa's site, you will see all of us, and now obviously Dr. McAleer, but those who've been trained to do the procedure. One of the things that I loved, Ashley, is that when we were in Ponte Vedra, besides that it was gorgeous, one, it was a women's symposium, and we had all these fabulous women from across the country of all shapes, sizes, ethnicities that were board certified to learn how to do this procedure even better. As we know, I have my population, I would say, is probably at least 60% women, maybe 40% male. And women will drag their significant others, brother, father, you need to check that, before sometimes they want to come in. What I liked seeing was that there was such a strong positive force that Treese really stood behind women and to make sure that their female doctors got access to what we needed to in an environment that we felt fun and safe. We even celebrated my birthday. That was my birthday weekend. Remember that? And I also loved seeing the diversity there because I was like, wait, oh my God, look at these, women from everywhere. Talk to us about how Treese makes for doctors who are watching this. What are the benefits for learning Lapiplasty versus any other competitor? What are the things that you do to make your doctors feel well-trained in an environment where they feel appreciated?
Well, I think like the biggest thing for me as being a rep is like, how can I help my surgeons help their patients? And the first thing is obviously getting hands-on experience on a cadaver, a live specimen that they can actually mimic the procedure 100%. So either we bring it to their office or we bring it to a facility near them.
So when somebody said cadaver, I'm sure I had somebody just pass out. But yes, we do mean, because I remember, okay, my dad's watching this, is going to kill me, but I remember back in podiatry school, I'm so sorry, where, you have cadaver lab. My mom's a retired nurse, my dad's business, my sister's an attorney. So, like that. So I went down, he's like, what is this? It's a cadavers. He's like, what? And he knows what it means. Cadavers are bodies that are dedicated to science that people graciously give to allow us to learn our crafts better in all fields of medicine. And I remember pulling out a dissected leg to show him what I was doing, and the man almost lost it on me, like, ah! So when you say cadaver, a lot of people are like, but it's a blessing that we get as physicians. I don't care what the specialty is, to make sure that we're practicing our craft at the best of our ability before we perform it on you. And that's one great thing about Treese. Continue, Ashley.
Especially like if I'm a patient, right? I would want my surgeon to be well trained on a procedure that they're going to do on me, so I have the best possible outcome. So it's my job to get those tools into their hands so that they're putting their best foot forward, literally. So Treese does a great job where you can either get a lab to you, or you can come to any of our symposiums that we have around the country. So wherever you are across the United States, there's usually a symposium that you can register and go to and get trained by top faculty from Treese Medical. These are surgeons that have done hundreds and hundreds of Lapiplasty, and you get one-on-one time with them to be well trained on the procedure. This is Lapiplasty as well as adductoplasty, so you can get all of it. You can also ask faculty there all these questions that you have, maybe go over cases that you may have that you're kind of tossing with if you want to do Lapiplasty or you want to do adductoplasty. It's just a great opportunity, especially for surgeons, to reach out to whoever their local Lapiplasty rep is and be like, hey, I would love to get trained on this procedure. I want to learn more. What can you do? And then to just take it even further is that we also support these residency programs, right? So we're doing labs with them. So we're training the next generation. So once they graduate, they're already one step ahead, and they can then, wherever they move or they go to, they can just reach out to their local rep, and they're like, hey, I'm ready. I have a patient that, found you and found me and wants the Lapiplasty procedure. And, I'm well trained on this now because I've scrubbed in multiple cases. I've done multiple labs. So it's probably the best in class beyond any other company that I've seen in orthopedics and foot and ankle. No one is doing the level of training that Treece Medical is doing.
I fully agree. I love that there are webinars that you can jump on. I mean, let's face it, we're all busy. Sometimes you're like, let me learn a little something. I love that you can go away and do that. And I love that you have the option of having it local. I remember when Ashley came to my office and we set it up, I had residents from St. Barnabas Hospital, Cooperman Barnabas Hospital, to be correct, from in New Jersey, Livingston, New Jersey. Shout out to them. I think our director is watching. And it was great. It was like, one-on-one. She knows that anytime we do work, I need food and coffee. And we had donuts and coffee, and we trained. And it was a practice. What's beautiful as well is that, your reps are in the operating room. So when surgeons do cases, we are also, as you can see, woo, power to the women. This was in Ponte Vedra where we had the Women's Symposium. You can see the diversity of women there from all over the country. And we're gowned up and we're practicing and we're learning and we're asking questions. Dr. Mackler was there and Dr. Vincent was there spearheading the conversations. And so when you can talk to someone like them and listen to a show like this, then you choosing to fix your foot is great because you know that this doctor has been trained on a variety of techniques to give you the best outcome. We can take that picture off and get the next Treece picture, if you don't mind.
I was trying to find myself in that photo, like, where's Waldo?
I know, right? So you see, tell us about the Stand Up to Bunions campaign.
So they launched this year, I believe, the Stand Up to Bunions, and it's all around National Bunion Day, which I believe is April 16th, which is awesome. So this program is it's worldwide, or I would say nationally, because we're obviously in the United States. And it's just another way for patients to get excited and also find the resources needed in their area to, get Lapiplasty or talk to a surgeon about getting their bunion fixed. So it's just educating patients and awareness around that you do have a bunion. Don't be embarrassed about it. There is help out there.
Okay. Fantastic. I think there's one more picture from Treece that you may have to my producer. She can put that up. I believe there's one more.
Yep.
There you go.
I think Dr. Mackler should talk about that one.
Yes.
Sure.
Dr. Mackler, Dr. Vincent, 100,000 patients treated. Amazing. That's a lot of people. Listen, don't anybody come to me when I'm on vacation talking about my bunion, especially those who go to the vineyard. A lot of times people want to stick their foot out at me. I'm like, this is a day to be watching it and asking questions. Not on vacation mode. No, ma'am, no, sir. So let's remove that and let's put up our x-rays and let's talk about some of these x-rays. Because again, this is the nitty and the gritty that we see. And I'm waiting for, there we go. That's a good x-ray. So I'll start with Dr. Mackler first, because these are your x-rays. So talk to us, like, this looks, when somebody sees this, who's a layperson, they're like, what in the heck is going on in here? Give, in layman's terms, describe this picture.
Yeah. So what we've done here is we've put a plate on, this is for the adductoplasty procedure, which is the precursor to Lapiplasty. So we fixed the other metatarsals, the smaller metatarsal bones behind the second and third toes. We fixated the third, so we put a plate on the third to hold the joint in place, and now we're getting ready to make the pilot holes to put the next plate in on the second metatarsal. So that's the apparatus you see on the left-hand side of the screen, and there's like a crossing pin just kind of helping to hold things in place while we do it.
And the pin doesn't stay there, guys. There's nothing coming out of your foot. You're walking with the pin. Can we see next x-ray, please? We'll give her a second for that. And Dr. Vincent, I want you to comment on the next x-ray as she gets it up. One of the things that, as she's getting up, there we go. Dr. Vincent, comment on that.
Oh, so this looks like just preparation for the joints for the adductoplasty. So the thing that I love about Treece Medical is that there are steps to the procedure that make it really reproducible and also very specific. So this particular step is just prepping the joint, but then there's another cut guide that you can use afterwards to kind of create the correct angle for the second and third metatarsals to become more aligned. So, as was said before with the training of Trees, there are multiple steps that I think you do need to be trained about these steps, but there's always a logistical reason as to why. And then you'll find out that once you get the steps down, it makes the procedure wildly reproducible and effective for the majority of your patients.
Fantastic. Fantastic. Can we have another? I'm going to let you do another picture while I get a connection issue going.
Okay.
And if you can talk about that, continue talking about that, Dr. Ebony Benson-Sleep.
Right. So this is the actual cut guide for the metaductus procedure. So it comes in variable angles. So depending on the level of deformity, like let's say, there's stages low, medium to high, right? You want to pick exactly which angle would provide the best correction. And this cut guide enables you to cut each of the bones meticulously in order to remove the cartilage and then prepare the joint for fusion in the correct angle.
Okay. Next x-ray. Dr. McAleer, talk about this is what we see when you guys come in with these bunions sometimes. And we're like, woo. If you're thinking woo, we're thinking woo.
this is the first thing that we look at when the patient comes into the office. Yeah. So you can see what we were talking about before. That first metatarsal bone, that long bone, you can see how it's shifted, and the bump on the side of the foot actually is the head of the metatarsal bone. And you can see how the big toe is deviated towards the second toe. And in this case, the patient had some degree of arthritis in the middle part of their foot. They have a little bit of deviation of those adjacent bones. So this is the conversation that we start having now with the patient. We'll say, well, Mrs. Jones, you come in to see us today for your bunion. Well, guess what? You have a bunion plus. And so you also have this other thing called adductus, and we're going to fix all of it. And doing an adductoplasty makes it so I can do a better Lapiplasty and get a better bunion result.
Absolutely. I think there's one more x-ray. Am I correct, to my producer? If not, let me know. Okay. I think this is the last one.
It looks like the bone cuts have been done here.
Yeah, the bone cuts have been done.
Yeah.
Okay. So what I want to see, let me ask the question now. So you're seeing this. Can we see to my producer, give us one more x-ray. I think you might have one more in there for us. Let me know if I'm incorrect. And people, let us know where you're from. We want to hear from you from all over the country. Okay, no more. So show me, I'm going to bring this, that's why you're a producer. If you can bring me back to, I want to get some pictures, some more foot pictures up of the actual skin before and afters, if we can put that up. So we saw that one. Let's go to another one if we have it.
Oh yeah.
Dr. McAleer, tell us about this cup, like I like to call it. What is that? Because people are looking at, oh my God, what is this man doing to my foot?
What is that orange cup all about? Yeah,
exactly.
So that's actually an instrument, which is ultimately what drew me to Lapiplasty originally. That is called the positioner, and the positioner is like a third hand for the surgeon while you're operating. We no longer have to manipulate the bones and hold them in place and try to find a way to cut them and pin them while maintaining correction. The positioner steers the bone back into its normal alignment, holds it there for us. Then we can make our cuts. Then we can tack it in place and then put our fixation in. So the positioner is a huge benefit for any doc that's doing these procedures.
Fantastic. Next picture.
Micro cut guide. Cut guide. Lapiplasty through a 2-centimeter incision, about the size of a dime.
I love it.
Yeah.
So I'm going to ask the hard questions now, because that's what I do. And so what I'm going to ask our producer to remove that picture. Thank you. And the hard questions. So we've seen some of these incisions. One of the things I have published a paper on medial and lateral cosmetic incisions for toes and hammer toes and bunions and all those types of things. One of the things that I've noticed is that, and Dr. Ebony Benson-Sleep, you can answer this, as can Dr. McAleer, that I see on patients who are darker in complexion, such as myself, that sometimes the scars, because where they're placed, can be visual, for lack of a better word. What do you say to patients? Because we have patients who are, divas like myself, who want to have a great outcome, for their bunion, but also want minimal visibility of scars. What would you say first, Dr. Vincent Sleep? What would you say to those patients? And Ashley, I'd like to hear, what you would say as well.
Right. So essentially we're worried about keloids, like nobody wants a keloid. It could happen at any portion of your body, especially for surgical scars. When it comes to bunions, I really make it a point to tell people like, hey, this is a biomechanic deformity. Like you want to have a sound correction of your foot. And unfortunately, it's not with the Lapiplasty specifically, you want to be able to have the best correction. And that means that the incision cuts have to be dorsally, but they do have mini plates and then they have the micro plates so that the incision sites can be smaller. So that way you have less chance of a keloid. And I also have really good patient education between what exactly the difference between a hypertrophic scar is and what a
Exactly.
keloid is.
Exactly, because unfortunately, people of color think everything is a keloid.
They think everything's a keloid. We think everything's a keloid.
We got a keloid. I'm like,
no. So I mean, it is a thing where because personally I keloid, and I've had 2 knee surgeries, so I always tell people sometimes I show them my scar, and I say, hey, like, my scar didn't keloid. It was hypertrophic for a while. And then it calms down and it flattened out. It's not going to be this thing that looks like a slug on your skin. And truthfully, foot scars, they do tend to heal over time. For people with more melanin, it does tend to take longer because our skin is already like hyperpigmented, and then it can be lighter or darker on the incision site. But there are other treatment modalities post-operatively that you can help to prevent or reduce the appearance of scars. But the most important thing you can do is to have a sound corrected foot. You don't want to have a beautiful scarless foot that doesn't function.
Dr. McAleer, what do you say to patients?
Yeah, I think what Dr. Vincent said is genius. If patients are coming in and you're giving them a poor surgical result, ultimately they're not going to be happy with the outcome. And so sometimes to kind of make an omelet, you have to break a couple of eggs. So, we are very cautious with our patients, especially we take a very thorough history with them. We ask them about hypertrophic and keloid scar formation. We're very sensitive to that, especially in our female population. The guys tend not to care too much about a lot of things that our female patients do, but the propensity of our patients are female. So we take that into always consideration. And I think one of the key things that we do when we're doing Lapiplasty and other techniques is, and not only do I do this in my practice, but we preach it and teach it, that we have to be kind to our patients intraoperatively, as little touching as possible, as little stress on the tissues as possible, so that you create the smallest amount of inflammation, the smallest amount of injury, and so the patients will heal better. And we have the fortune at our practice, we have dermatology and we have plastic surgery. So we have access to lasers and other modalities for treatment post-procedure. So if patients were to develop those issues, we just send them to our partners, and our partners are happy to help with those scars.
So walk us through, and Ashley, I'd like to ask you the same question, because Ashley's a guru in the operating room. Do this, do that, do that. You're like, okay.
Well, this was one of your biggest concerns, I think, when we started Lapiplasty, because I think when we started together, 2022, maybe 21, we had one of the first gens of Lapiplasty. So the incision was 6 centimeters, and you were like, my patients aren't going to go for this, the scarring, all of that. And then I was like, well, that's one of the best things about Treece, is that we're always, one step ahead. We're evolving, right? So the next gen, which came out, was the ability to do Lapiplasty through a smaller incision. So you would have a smaller scar. And I think we talked about this, and now we went from a 6 centimeter incision to a 3.5 centimeter incision that year. I think we launched the mini incision. From there, even now in 2024, you're able to do Lapiplasty through a 2 centimeter incision, which has now evolved where actually the hardware is different, where we went from a 4-hole plate to an actual 2-times speed plate, which is able to just pop in a 2 centimeter incision. So you're able to get the same result through a 2 centimeter incision that you were getting through a 6 centimeter incision. So talking to my surgeons, especially you, I think it kind of helped them with patients that wanted to get their bunion corrected, but were very, very scared and had bad outcomes previously with keloids and other scar issues.
Absolutely. Absolutely. One of the things that I challenge, and I'm going to challenge Dr. Mackler, Jody, I would love to see that Treese. I'm always trying to get everything from a medial lateral incision. You know that, Ashley. I'll push it to the other team. I would love to see that I can go a bit more medial. Medial means that instead of having, let me make sure I'm in the picture, instead of having stuff on the top, you can have it more on the side, and this side particularly. Do you see any, can you, let's just suppose, or do you see anything going a little bit more plastic? Because I can see Treese is going very plastics in terms of getting smaller incisions, and after that give you a better cosmetic outlook. Tell us, and Ashley, you can jump into that conversation, and Dr. Vincent, what do you see in terms of the future for bunions, in terms of getting that scar to be as hidden as possible? Talk to me about that.
So we spent a lot of time in the lab. We spent a lot of time in Ponte Vedra, working with the research and development team, working with our surgeon colleagues, working with the engineering team. And so that's one of the reasons that the micro technique came about, because when we first started doing Lapiplasty, we started off with about a 7 to 7.5 centimeter incision. And to kind of give you an idea what that is, we're talking about 3.5 inches in that space. We shrunk it down to just beyond about 1.5 to 2 inches. And now we have it down below 1 inch.
Mm-hmm.
So all of our instrumentation is predicated based on putting it on top of the foot, because it's the easiest way to make the most consistent bone cuts. So we have looked at approaches from the bottom, from the side, from the top, backward, forward, inside out, everything else. But we still kind of go back to that key concept of really wanting to make sure that the correction is reproducible and that the bone segments are put back. So constantly shrinking the incision, constantly trying to innovate, and really taking into consideration the cosmesis, especially with all the MIS options that are out there.
What's MIS?
Minimally invasive surgery, which is sometimes referred to as keyhole surgery. So essentially everything that we try to do, even with Lapiplasty, is making the smallest incision possible to give the best surgical outcome. So everything we kind of do is minimally invasive, but it goes hand in hand with these little tiny poke holes to get the job done. But they're through typically doing different kinds of procedures, something called an osteotomy, where you're cutting and shifting the bone, but we're prescribing to kind of more of a realignment of the bone with a fusion of the joint. So
I think the dog wants to hear about what you have to say, Dr. Mackler.
Oh, please. Quite entertaining.
He just busted in. I was trying to be like, oh,
I don't know. You were trying to be very soft, but we listen. Thank you, Sherry Taylor, for reaching out to us. Thank you so much. So I have more questions. Ashley, particularly to you. Tell me, I like patient outreach. That's a big thing to me, because to me, you sell yourself. It's simply, finding the doctor that you connect with that is well trained to do the procedure. So tell me about, talk about your best in class in patient outreach. What does that mean? I can say those words, but what does that mean? What are you giving to the people that are looking at this and people who are reaching out to their podiatrists across the country?
So I guess you have all different type of platforms. So it goes to the monthly webinars that surgeons nationally will, host, and we'll do Bunion 101 conversations from basics about bunions. And then from there, they kind of educate on the procedure. And then, what's been like the best, I guess we want to say the best option and best outcome for them. And then from there, we've created kind of a patient portal where they can go on and look up a surgeon in their area that's been trained. So there's the surgeon locator. Dr. D is on it, New Jersey, shout out. She's great, obviously. And there's just other events that we're doing. There's we're big sponsors, and we're the only, I think, orthopedic company, or the first one, to sponsor pickleball, which is taking over the world. Apparently,
tell us. Listen, I know it's big in Jersey. Like, I live in a fabulous gated community, and pickleball is it. And I've been like, what the heck is? I know.
It's addicting. I don't know why.
Tell us what pickleball is and why you guys are sponsoring it. I just think it's fabulous as I'm learning more about it.
So pickleball is like, I don't even know how to explain it, but it's a easier and more fun, interactive way of playing like tennis in a smaller court. You're not standing around, and it's not as difficult as tennis, and tennis matches last forever. So like a pickleball game probably lasts maybe like 20 minutes, 30 minutes. And anyone of any skill set, size, age can play it. So it's like, it's very, I hate to say this, but it's like the boomer sport, right? So it's like their thing, which is like the demographic that I would say is probably the largest population of bunions right now, that most people are getting surgery in that 50 and above bracket, but don't quote me on that because I don't really know that's a fact. But
I've had a lot of pickleball players, so you're spot on with that.
Yeah, I read something somewhere that like it's the number one sport for injuries of people over 50. Like it's like a global pandemic of like Achilles, ACLs, whatever. So I read that, it was like on Instagram or something, but
that's hilarious.
So I think we saw that like Tom Brady and all these people are buying these pickleball teams, and everyone's getting really involved in it. And now it's getting televised nationally. So getting involved with it was like a great opportunity for us to also do like field marketing, talk to people, like normal people, and get surveys and seeing what patients are doing for their bunions, why they're not getting surgery, why they are getting surgery, why they would choose Lapiplasty, why they wouldn't. So I think that's also a good like a segment for us to be in, because most of these people that are probably playing pickleball have a bunion or know someone who has one, and is probably just doesn't know yet that there is a solution that's going to help them long term. And then from there, obviously, we have the Facebook groups. We have, what else do we have? The National Bunion Day, which I talked about. There's emails, text messages, there's portals. The
If you want to find Treese, it is virtually
everywhere. Instagram, TikTok. I think we're on TikTok now.
Everywhere. I'm like, okay, like the fact that we're even talking about this is going to pop up in everybody's social media right now.
Yep. And there's a commercial, so you can even see it during The Bachelor. So anything, it's there.
True. That's true. I love stuff like this. One of the things that I wanted to ask was, so I'm going to give this question to Dr. Vincent Sleet. What makes you choose this procedure is coming from, let's give a little history, from a procedure that's classic in podiatry or in the orthopedic world as well, which is called a Lapidus, which is fusing the two bones together. If Dr. Macaulay could bring his foot back into the picture. You're our demo. There we go.
There it is.
Exactly. What makes you say, Ms. Smith comes to your office, why am I going to choose to do Lapiplasty versus any other type of bunion procedure? There are many, many bunion procedures that we are trained on quite well. Why is Mrs. Smith? What are the parameters that you would tell Mrs. Smith, this is why we're doing Lapiplasty on you?
Well, I was actually trained at Des Moines University, and they drove home the fact that a Lapidus procedure was the procedure to fix a bunion. Essentially, we are taught 100 different ways to fix this one problem. And the question is why? Why is there 100 different ways to solve one problem? There should be, there's not 100 different ways to do a hip surgery or a knee surgery or any other type of surgery. So why is it a bunion? You have all these options. I think that I approach the conversation in such that, hey, yes, there are varying degrees of bunions, right? And depending on your need, like if you're 87 and you're not trying to play pickleball, all you're trying to do is get rid of the bump that could be causing an ulcer, maybe you don't need a Lapidus procedure. But anybody else who's coming in that has a desire to be more functional and they don't want a bunion, I'm recommending that you fix the bunion correctly the first time, because it's unfortunate, but I have had a lot of experience with people who have had bunion procedures in the two-dimensional way. Let's say they had an Austin bunionectomy. Maybe they had a
I don't know
shaft
what an
procedure.
Austin
Oh,
bunionectomy is.
I'm sorry. Maybe they had their bone cut and shaped like a C in order to get rid of the bunion. And now the bone is forever misshaped. Now you have different types of anatomy, you know? There are procedures where you need to cut the shaft of the metatarsal, and
Can we see what the
now,
shaft is, Dr. McAleer?
yeah.
With the demo, with your finger, that's the shaft of the bone. Thank you. Thank you, Vanna
Right.
White.
It's just another way to reshape a perfectly shaped bone. Like, so there's no real need to think that you know better than your creator to reshape this bone. It's just out of position slightly, you know, it's out of the position in which it's less painful for you to have it. So my whole thing is, you know, the human body is amazing. It's very smart. It can come back from so many things. Like, all we're here to do is kind of assist how this process is going to be, you know. And so I kind of make it make sense to the patient on what, based off of what their needs are. To your point, there are other companies out there that do some version of a Lapidus bunionectomy. I was trained on the Lapidus, period. Like, you know, everyone
Myself
is, you know,
included, and
based off
Dr.
of
McAleer too.
their level of training. What sets Treese apart is the reproducibility and the equipment, the technology. Um, it's safe to say that the technology is second to none when it comes to the post-operative portion. It's easy to do a 45-minute to an hour surgery, but the patient is going to have at least 4 months to heal. You know, it's going to take at least 8 weeks for bones to heal. And when I tell patients it's going to take 8 weeks for bones to heal, they're like, do I have to spend 8 weeks in bed? Am I going to be bedridden for 8 weeks? You know, and then, like,
Sure.
you know, for with Treese, I'm like, no, you do not. You do not have to be bedridden for 8 weeks. Like, you can actually walk in a fairly short amount of time in a protective boot, you know? So the thing that sets Treese apart as being a different kind of company, that we were just not just doing a Lapidus procedure, we're actually taking care of the patient from start to finish and getting back to their activities a lot sooner and a lot more effectively than, let's say, someone who has to be off of their foot for a total of 8 to 12 weeks. Now you're dealing with like an atrophied muscle, lots of stiffness in
Or
the ankle.
compliance.
Like, you're just kind of trading one problem for another, but the recovery eventually will just be a longer time. You'll eventually heal, but Treese is trying to be effective and quick with all things surgery and post-op.
That's a beautiful answer. I agree. Dr. McAleer, I'm going to throw that volley to you. Why do you, Ms. Smith comes in, why would you give her a Lapiplasty? And tell me why.
Yeah, it's interesting because I trained in New York. I trained at Mount Sinai in New York City, right? So Corday and Dr. D and I were actually classmates. Yeah, we were.
Yeah, I was a year. So okay, now he's putting our business out there. But yes, I was a year ahead of Dr. McAleer, Jody, and we were from the New York school, so that's why I'm doing this. And so we trained on something similarly. Yeah, and I agree. So tell me, Ms. Smith comes into your office, and you decide to do the fusion of the bone, the Lapiplasty.
Yeah.
Why?
Yeah, I mean, I've been in practice for about 20 years now, and I've done it all. And in New York,
you're getting old, Jody. That's 20 years.
Every day. But we were trained essentially to do distal osteotomies, which means to cut the bone towards the head of the bone at the joint. And so we did what Dr. Ebony was talking about, doing an Austin, Aiken, all these variations of the procedures. And again, 133 different ways of fixing a bunion. It you know, how do I pick? How do I choose from that? Mm-hmm. And I did all the different iterations. And honestly, I found just nothing but confusion and dissatisfaction with outcomes for years. So much so that I used to tell patients when they came to the office, I don't want to fix your bunion. Come back later. Come back when it's arthritic. Come back when it's terrible, because it's going to come. Your bunion will come back, and you'll be dissatisfied with what we've done for you. So I migrated my practice to doing a fusion, a Lapidus style fusion, a traditional fusion, originally described at the turn of the century, actually in all journals, but in the Journal of Obstetrics and Gynecology. That's where the first paper was written for this foot surgery, which is amazing. And I started having better outcomes because I was fusing the joint. I was able to control the bone better long term, where it couldn't shift and move on me in the future. And then Lapiplasty came.
Oh.
It was like sky opened up, sun shined on me, and I said, "This is my answer." And between my partner and I, since 2017, we performed approximately 1,000 of these procedures at our facility, and we do nothing else at this point. We wholeheartedly believe in triplane correction, reducing
What does
the
that mean? That's a big word again.
triplane correction is when we fix, we don't just shift the bone over, we shift it, we rotate it, and we move it down. So we're moving the bone in
Three
all
ways.
three body planes all at the same time, and reducing this in what we have termed a natural correction, and essentially restoring anatomy. Instead of making a bone cut at a different location, like Dr. Vince was saying, where you're kind of cutting the bone and shifting it over and making the bone a different shape, and the foot may look good from the outside, but it's unstable on the inside, and over time the bone continues to drift and the bunion comes back. When we do Lapiplasty, and when we do this and we put plates in and we fuse that joint, this joint remains stable, but the big toe still moves, and the bone is locked in place. It stays in place. It bears weight properly, and the patients have a functional foot that they can walk, run, do cutting motions, play court sports, pickleball, basketball, anything that they want to do. They get through Zumba classes and hit cardio and everything else that they want. And our patients literally come from far and wide across the country. We have people flying all the time to come see us for this. And we like to think that we're really good at it, but we know that they're coming in because they know that they can trust the process and what we're doing.
Fantastic. I I guess you want to hear from me. I like the process. I'm very good about my cosmesis because I'm always concerned. I have a lot of patients of color for hypertrophic scars. So I try to be very mindful of the type of stitches I use because that matters. The technique in terms of handling the tissues, as Dr. Macular alluded to, that happens and that matters. And making sure that it's the right procedure for the patient, that matters. And also the compliance. If we tell you stay off your foot, and a lot of times we'll make you what's called non-weight bearing, meaning that you're on a crutch for maybe not weight bearing. Some people might do that for a week or two and then let you go in a boot. Some people, it depends on your doctor. I know I tend to be a little bit more on the, as Ashley knows. So I make them non-weight bearing on crutches and a cast or posterior split, which is like a half cast for the first 2 weeks because I don't want to hear about it. I'm like, because I don't want any shifting. Third week, I might be looking at you and I'm still like, I'm not ready for you. Fourth week, I'm like, here's a boot, and we go accordingly. And as an adult, bone usually takes about 8 weeks to heal. So when people are pushing us, it's not that we're trying to be meanies. It's that's what the good Lord gave you, and we're working with it. I always put my patients from a boot and then into a post-op shoe and then into a soft sneaker or clog. You know, people love these Crocs these days, which I can't stand, but if it works, it works. And I make them do some physical therapy as well. And they do well. They do really well. They have good function. They don't feel stiffness at the joint, which a lot of times with the older procedures, as you said, when we did bone cuts, people would have a lot of stiffness at the joint or just icky feelings that they didn't feel like they could move as much as they used to. And now with, people being quite active into their 60s, 70s, and even 80s, we want to make sure that we're restoring function so that you guys can live your best life. Pickleball, Zumba, hit, reggae, soca, whatever floats your boat. I'm all for it.
It's my whole weekend.
A whole week. Hey, rock, we're all about it. Whatever gets you moving and grooving, because that's important. So I thank you guys for being on my show. And what I usually do to close the show, and we'll start with Miss Ashley, 30 seconds. Tell us where we can find you, Miss Ashley Pittner, and say your name to us again and who you are.
I'm Ashley Pittner. I'm the area sales manager for Treese Medical in New Jersey, and I cover the Jersey Shore and North Jersey area. So if you're looking for me, you can find me with Dr. D in the OR.
Absolutely. Dr. Ebony Vincent Sleet, tell us who you are again and where can we find you?
All right, my name is Dr. Ebony Vincent Sleet. You can call me Dr. Ebony. It's my handle for all of my social channels: Instagram, Facebook, Twitter, etc. Um, and I work out of the Orange County area as well as the Long Beach area. So, yeah, myocpodiatrist.com is my website. You can find me anywhere.
California love. Dr. McAleer, where can we find you and who are you again?
Yeah, I am Dr. Jody McAleer. By way of New York, I am in Jefferson City, Missouri, the capital of the great state of Missouri. You can find me on Instagram at DRJP McAleer. And you can also find me on Facebook at JCMG Podiatry for Jefferson City Medical Group. And you can also find us on our website, www.jcmgpodiatry.com.
Thank you, Miss. I think I'm saying MSK Turn. Thank you. We appreciate your support. I see you. And my name is Dr. Cordai Decoto, and I am the founder of Talks with Dr. D. Talks with Dr. D is a three-pillared organization where we have Stepping Forward with Dr. D, which is a monthly show on Black.org, our platform, to give you insightful information and education all things lower extremity that pertain to podiatry. Our second pillar is because what are we wearing today, everybody? Pink. Breast Cancer Awareness Month. I am the CEO of Talks with Dr. D Breast Cancer, and you can find information about my journey. You can find information from different interviews with different medical professionals on my YouTube channel, and also follow me as I do various speaking engagements that are usually filmed and given to you guys so you can be in a safe place as a survivor, a warrior, or a caregiver and a supporter for breast cancer. And obviously, my last pillar is Sisters on the Vineyard, which is a recreational, beautiful retreat that gives you education, advocacy, financial literature, which we teamed up with the various pharmaceutical companies such as Eli Lilly, Pfizer, oh my goodness, we did JP Morgan. It was a fantastic event. You can find me on social media, YouTube, Facebook, LinkedIn, IG at Talks with Dr. D, where we are going to continue to educate and entertain you one day at a time. So I'd like to thank our guests, Dr. McAleer, Dr. Ebony Vincent Sleet, Ms. Ashley Pittner. This was a great coming together. Treese Medical Concepts, thank you so much. I think that this is great that we can educate our communities and make sure that people make sound decisions with their doctors for the best bunion surgery, for the best outcome. So I thank you. Happy October. Happy Breast Cancer Awareness Month. And with that, my famous thing to say to everybody is walk strong. Thank you. Bye, everybody.
Bye.
Bye.